evidence-based programs to Wayne County and the surrounding communities, and that includes PATH, which is Personal Action Toward Health, EnhanceFitness, which is an exercise program, Tomando Control de Salud, which is the Spanish version of PATH, and then encouraging people to use the area diabetes education programs at local hospitals. And it's been amazing to see the turnout that people have had, the life-changing steps that they've been able to make. And we've reached over 11,000 people, and that number is continuing to grow the more we expand our programs.
Personal Action Toward Health. It's a 6-week self-management workshop, a health management workshop.
PATH is beneficial for persons with chronic health conditions, which is a long-term health problem. So it's something that you're dealing with that's not going to go away.
So many people assume that a diabetes program is just going to be the educator standing up and lecturing. And the purpose is to get you to give you the tools and the information that you need.
Well, what's so important about EnhanceFitness that it offers people an opportunity to exercise, people that have not ever exercised before in their lives. It offers them opportunity to exercise at their own pace, low impact, in a friendly environment for them.
You know, at the federal level, we fund so many activities across the country, and very seldom do we have an opportunity to see the results of the work of our grantees. But seeing all of you here this morning just really brings to life for me all of the things that I've been reading over the past 3 years about the progress being made on this program.
A little over 3 months ago, I couldn't use my left arm. I couldn't wash my hair. I couldn't open things.
Something popped in my knee and I was just incapacitated.
My mother was blind. I have 2 sisters that are blind due to diabetes.
I was so depressed with COPD and the fact that I could no longer do what I was doing. I was completely defeated.
I think about when I started participating, it's the first chance I had to take inventory of my life. Our life is filled with all kinds of challenges, so we kind of jump from one crisis or one test or one challenge to another. Never really start thinking about what is the thing I can do for myself.
A lifestyle. It's not just something to do. You know, I'm going to exercise here because without consistency, you're not going to see results. So I try to encourage the participants to be consistent, because once they get the bug and once they see that there are results, there's no better seller than that. It actually sells itself.
I learned the power of myself, what I can do for myself.
How did the EnhanceFitness program improve my life? Well, in many ways, it has helped improve my life.
We regained all my mobility. My sciatica is no longer acting up.
I can use my right arm. I can wash my hair. I can open things, and I can even crack lobster tails.
I'm able to keep up with my grandchildren, the great-grands. I do think I'm out all the time. I'm always going somewhere, always doing something, and always looking for something else to do.
Where I was stiff, I'm not stiff anymore through the exercising.
The instructors are very caring and we get a very thorough workout, and I really enjoy it. I look forward to it. It's one of the highlights of my week.
It helped me to learn more about chronic illnesses versus acute illnesses.
What I was taught were things I wasn't taught in the hospital.
Developed an action plan and feel personally responsible to follow up the plans to set for myself.
I'm now not smoking for over 30 days, and I've been a smoker for over 50 years.
It's made my life, I can honestly say, worth living again.
I feel my life is happier, and that's what we all want to do.
Helped me to handle stress in my life. I have lost weight. lowered blood pressure, and also made me feel better and sleep better and solve problems better.
If there's no return on investment, you'd have to ask yourself, is it worth doing it? If you worked all day and brought home nothing, would you work? Most people would not. Most people are not just living to work for nothing. You see numbers for PATH and Tomando, 0.8 million to 1 million, with 2,054 participating. So this ranged from $400 to $500 a person. That's not trivial. EnhanceFitness, you see 1,934 people saving $1 million in diabetes self-management, where you would anticipate the greatest savings to occur to be 2 million to almost 15 million. So at the worst, we saved $3.8 million.
It wasn't the Kidney Foundation that was reaching these different communities. It was our partners and the relationships that we had with our partners who were able to do it in their own communities.
That's why DSME, or Diabetes Self-Management Education, PATH, and EnhanceFitness are such a wonderful triad of programs, because they each feed on each other and they promote the same focus on that self-management and taking care of yourself.
So just being able to build those partnerships, build those coalitions, getting people to really believe in our mission and our goals and include that in their own mission and goals, that's how we're going to make it work and continue to spread not just our programs, but their programs alike.
This is really informative to me, that I can take care of myself and teach my children and grandchildren how to eat right and exercise so they don't get, fall into illnesses.
It is an evidence-based program, and it works. So I would definitely recommend it to everyone.
I have recommended it and will continue to.
I would tell everybody. I would stand on a soapbox, yes.
It can help anyone. It truly saved my life.
I thank them for allowing us to have this opportunity and for allowing us to be able to participate in a program that at no cost. It's just a wonderful thing, and I'm really thankful for it.